Hi, good afternoon. It's Chief Roger Marten, Cold Lake First Nations. Just wanted to say hello. It's October 14th, 2020. Unfortunately, what we always feared has happened. There was a positive case of COVID-19 on the nation. With that, I'm going to pass over to Lillian to give you more information.
Thank you, Roger. So yes, today at approximately 11:30, we were notified of our very first positive COVID-19 case here on the nation. So that being said, we knew that it was going to come. We have been preparing our community and for this for the last 7 months. So I just want everybody just to take kind of a deep little breath and relax and we're going to get through this. So right now we are in contact with the individual who has tested positive. We will be doing our contact investigation around this individual. This individual has notified several of his immediate contacts, family members, household contacts, and they have already started coming in for testing. And now that being said, it does not mean that I want everybody to rush in for testing either. We really want to focus on the case itself, those closest contacts and the individuals connected with that case to start. So I do ask that people, if you can, please call and book an appointment to come in and get tested. And we will be reaching out specifically to those individuals who are at a higher risk, who we need to contact and get them in for testing. This individual is at home and is quarantining along with the household members. And so that is the expectation for us going forward as well. So when we have a positive case, they must quarantine for a full 14 days from the onset of symptoms. And that is through the medical officers of health recommendation with Alberta Health Services. And we do have a protocol that we will follow with each of those contacts of this case. And so once we get you in, get you tested, and have an initial investigation done and ask you some follow-up questions, we'll be able to determine what portion of time you need to isolate at home for. And we will be making those phone calls here shortly. We do ask, we have had a lot of phone calls, Roger, at the health center here today. We ask that people just respect that individual's, confidentiality is an important thing. And we're not going to give out any names of individuals. And I really want to stress that. I want you to, be cognizant of that and respectful of that we are not going to release any names. We will be in contact with you if you have been named as a contact for this individual. And please just let us do our jobs in that way. That again being said, we do offer testing. So if you are symptomatic in any way, and we always have offered testing at our health center, if you are symptomatic right now, you can come in and book for a COVID test and we can get it done for you. The girls, we actually just had an extension built onto our building to get you in out of the elements, so we're not doing the curbside testing throughout the winter. So we do want to encourage people that if you are having symptoms, please book an appointment, come in and get tested. As well, we are doing flu shots again this year. So we're trying to do that in amongst doing this. So please be patient. We are a little bit overwhelmed at the moment with some of the work that we have to do. So that's why we're saying don't rush the health center just because you think you might have been a contact of a contact of a contact. Please let us do our work. And we will be in touch with you if you are at high risk. But if you are symptomatic, please come in and get tested. Okay. And
I'd just like to add to just be safe. We know this has been around for a long time. There was cases like in the city of Cold Lake before, and it didn't really disrupt a whole lot on the nation. So if we could just be preemptive and precautionary about the measures that you take for safety, like wash your hands and
we have all the tools,
mask and
right?
all that. We have all the tools. We know it was coming. It's just a matter of time. So now that it's here, we just gotta kind of amp up our safety and just be cognizant with we're more safe on what we do as people. Just to let you know that the EOC team will be reinstated as part of our agreement when we discussed worst case scenario. If there was an outbreak of one case, tested positive, chief and council decided that if what worst case scenario, if one person tested positive, we were going to have kind of like reinstate the EOC team. So that's being placed to help protect the community to the best that we can.
And that just helps to improve communication. So really, when we bring that EOC team together, it just means bringing all of our minds to the table and making sure that we're working through each problem systematically and efficiently and for the best of the community.
And like I said, it's going to be pretty well banned business as usual. Everything's going to be open. Just banned won't be open. The businesses won't be open to the public. Like the office won't be open to the public per se. But for the most part, it'll be like business. With the offices will be day-to-day affairs will still be going. There'll be no disruption. Just we'll just do the best to keep the people safe. As to that, businesses will be notified. This business will be open. Like I said, it'll be just...
Again, we have all those tools in order so that we don't have to have the lockdown that we did in the spring, right? So we know that wearing a mask goes a long way in preventing contamination, preventing infection with COVID-19. We know that washing your hands, using the hand sanitizer goes a long way, as well as physical distancing. And so, like I said, we have all the tools to manage COVID-19 on our nation. And so I do really emphasize that with people. Just maybe we've gotten a little bit complacent with those tools. And so now we need to really be aware of our surroundings and how we utilize those tools that we've been given.
Yes.
And so, like I said, just take a deep breath, everybody. Don't panic. We've been expecting this for a long time, and we will get through this. And we'll have updates for you periodically and let you know how things are going.
And just on another note, that the banned businesses are going to be closed, but like I said, closed to the public. But with that exception, the daycare and the school will be open. So those are the only two for now.
Yeah, if there's something that you can manage through a phone call, that is the best thing to do right now. We always want to make sure that we're protecting our workers and we're protecting our public at the same time. And we do close our office buildings. And the reason that we do that is we want to make sure that we limit the amount of infection if there is an infection present. Mm-hmm. And we can't afford to lose people in the positions that we have them in right now in the various different departments, whether it be in public works, in health, and housing, and in education. And so we ask people to try to limit their contact with those individuals. So if you're able to make a phone call to solve your problem, please do that. It doesn't necessarily always take a visit in order to do that. So that's what we ask.
And the number to the health center, if you want, is 780-594.
2473.
There you go.
There you are.
Yes.
So that being said, again, we just want to make sure that you guys are in the loop, that we're keeping you in the loop. We do have one positive case on the nation, and we will work through that case and be in contact with those who we need to be in contact with. And just be safe out there, everybody. Make sure that you're using the tools that you've been given. So practice hand washing, social distancing, and wear a mask where you can.
Yes, and with that being said, thank you. I just like to say from Chief and Council to be safe out there, from us guys to you guys. Just be safe, and we prepared for this, and it's here. So now we just move on best we can and try to. The best safety is going to be going to be our number one focus again. So just let you guys know we're on it. We're doing all we can. Thank you.
Very good.